picture this. There's two people sat on a bench at a bus stop. All of a sudden, this guy comes over. He's looking really agitated, quite distressed. He kind of glances in their direction, looking really serious. Both of them kind of shuffle over as he sits in the middle of them. So the first person starts to think, oh gosh, what's going on with this guy? He looks really distressed. He looks a bit angry. Was that anger pointed towards me? Is this a safe situation? And they start to actually feel unsafe. They started to feel really uncomfortable sitting there. And it actually causes them to want to leave. And they get up and they go. They say, oh, do you know what? This is a bit too much. I don't know what that guy's going to do. I think I'm just going to leave. I'm just going to walk to work. The second person actually starts thinking about that guy as well. But their thought life actually takes them to, what's going on for this guy? He looks really agitated. He looks really upset. Is he okay? They feel some care towards the guy. They feel like they want to help. And what they do is they actually lean into the situation and say, you all right, mate? What's going on for you? You look a bit distressed. Are you doing okay? So regardless of what happens in the outcome of that story, what we're seeing here is the exact same situation happening for two different people, but their behaviours are really separate and really different. Why is that? It's because of their cognitions. It's because of their thought life and the story that they're telling themselves about that situation. The first person's cognitive thoughts are, this is unsafe. This guy is angry towards me. I'm not sure what's going on, so I'm going to leave. The other person's thoughts are, this guy is distressed. Is he okay? I'm going to lean in and see if he's all right. What happened for you in that story? Were you thinking, oh yeah, that guy sounds dodgy, I'd have left too? Were you thinking, oh my gosh, what's going on for him? I need to know. Is he okay? Were you thinking something else entirely? That's what we'll be looking at in cognitive behavioural therapy. What are the thoughts and the stories that you're telling yourself about different situations that are actually then leading for you to have feelings, which then lead to behaviours? Obviously, if you're looking at coming to therapy, there's behaviours in your life that you don't want to live by anymore, that are actually troubling you, that are actually getting in the way of you living the life you want to live. And so during this type of therapy, what we'll do is we'll narrow down what that is that's going on for you, whether it's a mental health issue like depression, anxiety, phobias, OCD, PTSD. CBT can work with a range of different mental health disorders, or even if it's just challenging some day-to-day problems and some scripts that you've got going on in your head that you can't seem to break away from. That's what we'll be doing in the therapy. We'll be narrowing it down to see what it is that you want to work through. CBT is quite solution focused, so we'll be looking at goal setting. We'll be looking at how can you think about this differently? How can you behave in a different way? And so there'll be times when we're working in collaboration to do tasks even outside of the sessions. You know, some people, the idea of homework, they think, oh no, this is not the therapy for me, I just want to talk. Some people will revel in that, but maybe even in that moment challenge those thoughts. Why is that? Is it because there's a nervousness with homework? Is it because you can't be bothered? What's the story you're telling yourself? And can we learn a different story? So that'll be the focus on how I work with you using CBT. But if you do have any more questions, please just drop me a message. If you're not already on the website, it's gracious therapy.co.uk. Thanks for listening.